I actually do. I'm a clinical scientist and nurse practitioner here at the clinic, at the wound care clinic at Women's College Hospital. I actually just sort of finished my PhD, so it's really, there's different stages that I've gone through from the baccalaureate. You know, I was inspired to really make a difference at the bedside, to really provide the best care I can. And then with the master's and now PhD, is really, I mean, the interest to connect with patients is still very keen. I think that's the key about the profession. It's not about, you know, sitting in a desk or, you know, working in a classroom environment. Well, I think there are many good reasons why people should go into this program. One is to learn there's a lot of content, substantive content, that will be extremely beneficial for our careers, whether we want to continue to be a practitioner or an administrator, educator, researcher, in all kinds of aspects within nursing. I think the other part is really trying to be inspired. I think it's really inspiring to have that group of leaders, that group of keen individuals inspiring each other. Yes, we can change the world, so to speak. We can change nursing, we can change patient care, we can change paradigm of thinking. In the program, you know, I've learned that, you know, there's a lot of business type things that I've never learned before, and that's actually really helpful for me to look at how to draft a business plan, how to structure some of the outcomes when I look at evaluation, and also looking at a change theory as well from a different perspective. The PhD thing has been really taking a lot of my time, and the career building, and I think it's definitely taking a lot of time. Definitely I would like to spend more time with family and friends, and I think just, you know, talking on email, talking on the phone is not quite the same as getting together with friends and you know, having a nice dinner, this sort of thing.
I'm part of the advisory committee of the Rising Stars program, so as such I sat down with Maureen Cava and Nancy Lefebvre, and we actually talked about what we needed to provide these nurses to become better leaders. So we talked about what type of academic, what type of stretch opportunities, what type of meetings we'd like to see them go to, how we'd like them to visit the other organizations. We've seen a huge growth in our Rising Stars. All of them have grown both emotionally, both as leaders, both as nurses.